Hello and welcome to this Infection Basics video. I'm Dr. Aled Roberts, and in this video we're going to look at diphtheria as an example of an upper respiratory tract infection. Now, diphtheria is what we would call a toxin-mediated infection caused by the gram-positive bacteria Corynebacterium diphtheriae, and infection begins when the bacterium enters the upper respiratory tract via respiratory droplets that are expelled when an infected individual coughs, sneezes or speaks, and are then inhaled by a new host. Now, these droplets are then deposited on the mucosal surface of the nose or throat, where the bacteria can adhere and begin to colonize. The infective dose is relatively low, although it is not precisely defined, and the incubation period is typically between 2 and 5 days. Now, as the bacteria multiply locally, toxin production can lead to tissue damage and the early formation of a pseudomembrane. Now, this happens because of a key virulence factor, and that is the diphtheria toxin, or DT for short. Now, not all Corynebacterium diphtheriae strains produce this toxin, only strains containing the tox gene, making them toxigenic. Now, DT is an AB toxin which enters host cells and disrupts protein synthesis, which ultimately causes cell death and tissue necrosis. And this is key to the development of the pseudomembrane, which is a key clinical feature of the disease. You see, as DT damages tissue, plasma proteins and fibrinogen are released along with the debris of the epithelial cells. These mix with the bacterial cells and the cells of the immune system, forming a characteristic grey-white membrane structure that adheres strongly to the host, causing bleeding if it's removed prematurely. Now, complications do arise with diphtheria infections. The first is airway obstruction, where the infection and inflammation spread to the epiglottis, leading to swelling and the partial or complete blockage of the airway, something we need to look out for in very young children. Other complications include things like myocarditis, where the DT toxemia, so diphtheria toxins in the blood, which are taken up by cardiac muscle cells, result in cell death and potential heart failure. And finally, we have neuropathy, which also results from DT toxemia, except peripheral neurons take up the diphtheria toxin, leading to the demyelination of neurons and the disruption of nerve transmission. Now, both myocarditis and neuropathy are examples of toxin-mediated complications, and so we need to remember that the infection is localized to the nasopharynx. Neither the heart nor the neurons are infected in these instances, and the pathology is entirely toxin-mediated. Okay, so how do we go about treating diphtheria? And so as soon as diphtheria is suspected, the patient will be given antitoxins, which neutralize DT toxins within the blood, preventing further damage to the host. To clear the infection, we can use a range of antibiotics effective against gram-positives, but tend to rely on erythromycin, giving it a taste of its own medicine by inhibiting its own protein synthesis, and penicillin. Now, treatment is a key to survival, with around a 90% survival rate in those that are treated compared to just 50% in those that go untreated. Now, to help with this, there have been highly successful vaccination programs using a diphtheria toxoid, which has made diphtheria cases extremely rare. Now, the vaccine is made from an inactive form of the DT and is capable of stimulating an immune response without any of the tissue damage or disease. Now, this vaccination is delivered multiple times as part of the DTaP vaccine known as Tripedia, combining vaccinations against diphtheria, tetanus, and pertussis. And so following vaccination, around 95% develop immunity, resulting in a decrease in the number of cases globally and allowing a level of herd immunity that protects those unable to get the vaccine. And with that, we come to the end of this video. I hope you found the content useful, informative, and most importantly, easy to understand. Thanks for watching, and I hope you have a great day.